Hey everyone, and welcome. Today, we're jumping into a patient complaint that you probably see all the time, but might not always have a clear framework for: halitosis. We're going to break down how you can assess and manage it like a pro right from the pharmacy counter. Okay, let's kick things off with a number that really puts this all into perspective. Up to 50%. Think about that for a second. Potentially half the people walking through your doors could be dealing with this. That makes your role in counseling them absolutely critical. So, here's our game plan for today. We're going to start with the big picture, the clinical view. Then we'll get into how to classify it, walk through a really practical assessment you can use, talk therapies, and finally cover when to monitor and when to refer. First things first, let's reframe how we think about this. This isn't just bad breath. For our patients, it can be a major source of anxiety and can seriously impact their confidence. It's a legitimate quality of life issue, and you're in the perfect spot to be their first line of support. And this is exactly why it matters in your pharmacy. You're not just selling a product, you're helping restore someone's confidence. And maybe even more importantly, you're acting as a critical screening point. Sometimes bad breath is the first sign of something else going on, like gum disease or even a systemic issue. Now, before you even think about recommending a product, the absolute first step is to figure out what you're really dealing with. This is your most important triage step. Is the odor actually real? Is it just something the patient is worried about? Or is it something more? First up, you've got genuine halitosis. This is the real deal, right? The odor is actually there, and other people can perceive it. Your job here is to start thinking, is this just related to bacteria on the tongue, or could it be a flag for something else? Next is pseudohalitosis. This one's a bit different. The patient is super worried, totally convinced they have bad breath, but you can't detect anything. This calls for a totally different approach, one that's focused on education and reassurance, not just a product. And finally, there's halitophobia. This is when a patient just will not let go of the belief that they have halitosis, even after a dentist or doctor has given them the all clear. This is really a psychological condition, and the best thing we can do is a sensitive referral. So for that genuine halitosis, where is it actually coming from? Well, this is pretty fascinating. About 90% of the time, the problem starts right in the mouth. We're talking about bacteria, usually on the back of the tongue, that produce these smelly, volatile sulfur compounds. So while we need to be aware of other causes, our main focus is going to be on oral hygiene. Okay, so how do we take all this and turn it into a quick, effective consultation? Let's build a practical assessment framework you can use, even when the pharmacy is busy. So what are the magic questions? To get to the root of the problem, you really just need to ask a few targeted questions. This isn't about a 20-minute deep dive. It's about being efficient and effective. And this table, this is basically your cheat sheet. You're going to want to ask about their daily routine. Are they brushing, flossing, cleaning their tongue at all? Diet's an easy one to check. But this dry mouth question is huge. So many medications cause xerostomia. And don't forget to ask what they're already using. Sometimes their current mouthwash is part of the problem. All right, you've asked your questions, you've done your assessment, now it's time to talk solutions. But, and this is a really big but, we always start with the fundamentals of good hygiene before we ever talk about a single product. This is it. This is the single most important message you can give your patient. No mouthwash, no gum, no mint is a magic bullet that will fix this. It all comes down to physically removing the bacteria. If they only remember one thing from your conversation, make sure it's this. And here's how you can explain it to them, nice and simple. They can use a dedicated tongue scraper, or hey, even a small, soft toothbrush works great. The key is to be gentle. Just light pressure, sweeping from the back to the front. No need to scrub like you're trying to remove paint. On top of tongue cleaning, you can give them some other really helpful, simple tips. Staying hydrated, that's a big one. Chewing sugarless gum is great for getting saliva going. Little lifestyle changes like these can add up and make a real difference. Okay, now we can talk about products. If a patient is looking for a mouthwash, these are the key active ingredients you'll run into. Chlorhexidine, is prescription only. It works, but you have to warn them about the staining. For over-the-counter, you're mainly looking at CPC, which is an antimicrobial, or zinc compounds, which actually neutralize those stinky VSCs directly. Now, here's a little dose of reality that's really important to share. We have to manage expectations. The truth is, the evidence for a lot of these mouthwashes isn't all that strong. This just reinforces why that mechanical cleaning we talked about is and always will be step number one. But here's a fantastic pro tip you can give them that'll make any mouthwash they use more effective. Tell them to use it right before they go to sleep. Why? Because our mouths are driest at night, which is like a party for bacteria. Rinsing before bed gives those active ingredients the longest possible contact time to do their job. Okay, let's move into our final section. This is all about closing the loop, monitoring how things are going, and, crucially, knowing when it's time to refer the patient to another healthcare provider. This timeline is super helpful for setting expectations. With good hygiene alone, they should see some improvement within a week. If they're using a product, you can check in after a few weeks. But here's the bottom line. If a month goes by and nothing has changed for the better, it's time for a referral. And these are your non-negotiable red flags. These are the signs that tell you this is beyond a simple over-the-counter fix. You see bleeding, gums, sores, that's a dentist, straight away. They mention chronic sinus issues or reflux, send them to their doctor. And of course, if good therapy isn't working or you suspect it's more psychological, that's a referral too. So I want to leave you with this final thought. Don't just wait for patients to come to you asking about bad breath. Think about how you can proactively work this in. You're counseling someone on a new medication that causes dry mouth? Boom, perfect opportunity. Helping someone with smoking cessation? Another great time. This is how you take your care to the next level.